The World Health Organization declared the growing monkeypox outbreak as a global health emergency, which is one step below that of a pandemic. Meanwhile, India reported its fourth case of monkeypox. A 31-year-old man from Delhi was diagnosed with the disease. The man is said to have no foreign travel history, unlike the other three cases. On the global front, more than 16,000 cases have been reported across 75 countries so far, and there have been 5 deaths. More cases are being suspected, possibly in Telangana. The Union Health Ministry chaired a meeting on the same and has advised close surveillance and contact tracing. Now, the question is, what really is the extent of concern as far as monkeypox is concerned? Ramanan Laxminarayan, epidemiologist and economist, with us today on the show. Dr. Ramanan, always great to speak with you. Now, we are in a space where COVID-19 has still not left our, collective consciousness. We're still dealing with that, but the fear has obviously retreated with vaccinations and lower death rates. What about monkeypox? How afraid should we be?
So monkeypox was always on that list of diseases that you thought this could be a major problem in the future. So it's a classic zoonotic infection, which means it comes from animals and jumps to humans. However, monkeypox has been with us since 1970 that we know of, and probably far before that. And it has never really, spread so widely before. But even so, you have to see 16,000 cases as with some amount of concern, because why is it not spread for 50 plus years that we know about, but it's suddenly starting to spread? Is it possible that there is some connection with immunity to COVID, et cetera, et cetera? So all that I'm trying to say is we just don't know enough about monkeypox yet. The current strain, typical old monkeypox strains would the case fatality rate, which means the proportion of people who have it who die, is between 3 and 10%, very high. But this monkeypox doesn't appear to be that way. It seems to be that even out of 16,000 cases, there have only been 5 deaths globally. So it seems to be a much less harmful version of monkeypox, which is something to be happy about. But at the same time, it's a little concerning how it's spreading so quickly when it's very easy to recognize. Because the lesions and then afterwards the scabs are very easy to recognize. Last point I'll make is that in a study that was done recently, more than 95% of the people who got monkeypox were gay men who also had multiple partners. So it seems to be very focused on one segment of the population, and much like HIV. So that's the other thing to keep in mind. It's not a generalized epidemic in the sense of spreading widely in the non-homosexual population.
No, so just to be clear, Dr. Ramanan, this can spread to anyone when there is that extent of contact, right?
Exactly.
Right.
Yeah, it's not like others are immune, and it's also not only sexually transmitted. Any close skin-to-skin bodily fluid contact can result in transmission.
So, this has also become an issue because, as the World Health Organization has said and as you've described, a lot of the cases have been seen in homosexual men so far. And this community is now saying that we're being targeted once again, like we were during the HIV pandemic or the HIV disease when it was first discovered by mankind. How do we avoid that kind of targeting from happening?
This is a great question, and one that we should really pay attention to, because it's not the fault of anyone that they get monkeypox. Certainly I think we need to recognize that the gay population is vulnerable to that kind of targeting for sure. But at the same time, people, we need to be aware of what the risk factors are. As I said, even with the gay population, it's those with multiple partners that were highest at risk. So the same sort of idea that sexual activity with multiple partners can be challenging, whether straight or gay populations, and maybe some of the behavioral change that came into place to avoid HIV transmission may come back here as well.
In terms of precaution for COVID-19, you had masks because ultimately people figured out that it was airborne. What is it for monkeypox? Now that we know that it's possibly out there and we've had 4 cases, at least in India, in fairly quick succession, how can people prevent themselves or protect themselves?
First of all, the numbers in India are still very small. This is not a disease that I see exploding the way we saw COVID likely to explode. So, what I said there is very different from what I'd say here. Here, it's not going to be an exploding disease. It's not something for people to really, the general population to really worry about. I think watch out for people who have lesions on their hands, basically, and then scabs. The transmission starts about 2 days before those lesions come on. So if you have something on your hand, like a pox, like people used to have chicken pox, then definitely take it to a doctor and get that examined. And if there's a government report to be filled out, certainly do that. It mostly protects that person and their families from being, from the transmission. But by and large, I think economically for just our normal functioning day to day, I don't think it's going to disrupt our lives at all.
All right. Thank you so much, Dr. Ramanan, for joining us and just breaking that down for us as we now start educating ourselves and learning more about the new disease in town, monkeypox this time round. Thank you.
Thanks for having me.